You can bring it.
You're wearing my favorite title.
You're one?
You're wearing my favorite title. I love that.
Are you providing a shower today? Do you like doing a shower? Oh, I wondered. No, I just moved the chair. I've got those. Okay.
Hi.
Clerk, call the roll.
William Wesley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Ficus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Chaplain First Lieutenant Cody Bailey of the Alliance Community Fellowship and Texas Air National Guard. After the invocation, please remain standing for our pledges. Thank you for being here.
Thank you, Judge. Appreciate it. Thank you, commissioners, for having me. Thank you, officials, Tarrant County, and those who advocate for our wonderful residents. If you would like to, please join me in a moment of prayer. Heavenly Father, we thank you today that we get an opportunity to come before you to honor and bless those who are willing to serve. Lord, an act of service is what we are about today, and so thank you so much for the calling that you have put on our lives. Lord, today I ask for a special prayer of blessing, of protection, of wisdom, of guidance to those that are in this room today and those who are with us via Zoom conference. Lord, we love you so much. We thank you for all that you have granted us, and continue to bless this county, this city, this state, and this nation. We love you, and it's in Jesus' name I pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you, Pastor, for coming out today. Mr. Manius, agenda announcements.
Thank you, Your Honor, members of the court. Some items dealing with the agenda this morning. We're going to hold several items. The first one is under the administrator section, item number 3. This is a calculation and a designation of no new revenue and the voter-approved tax rates. We'll be bringing that back to court next week. And item number 4, which deals with the hospital district, we are going to bring that back to you all again next week. Let me just mention, when we why we're doing that. Our original calculations were correct. If we go forward in the budget process yesterday, we talked about the possibility of moving a cost center from the hospital district to the county, and that's public health. On the truth and taxation form, there is a need to calculate that transfer from the district and to the county, and it affects both the county rates and the district rates. We discovered that late last night, and we want to just make sure that whatever we bring to you, that you fully understand what's going to be happening, and we'll need some direction from you all prior to submitting that.
So I want to be sure I understand what you, of course, we're discussing it, but what you're saying is should we make that decision, it affects their calculations, it affects our calculations and everything in between?
Yes, yes. And there's a section on the truth and taxation form that you have to, it's another gyration that you have to go through. So we'll be bringing some more material back to you on this thing, but staff, I don't feel comfortable bringing these projections to you right now. And we have plenty of time to do that, and basically we want to do it correctly whenever we bring that forward to you.
Because I agree, and if it ends up being too major last minute of an undertaking, then that is something that I think could happen in future years. It doesn't, I mean,
Yeah.
whenever it happens, but.
And we just want to go back and check some numbers and do some recalculations. And so that's why we're pulling those. Also, members of the court, under the administrator section on item A8, this is amendment number 1 to the AIDS Healthcare Foundation subrecipient contract. We have some dates wrong in that contract, and we need to correct that. So we're going to hold that and bring that back to you next week.
You said that was A8?
Yes, yes.
Gotcha, okay.
Also, court, you might remember that yesterday we talked a little bit about the hospital district coming forward today and maybe talking a little bit about the closing of school clinics. I spoke with Dr. Duncan last night, and it's a pretty long discussion, and so I'm going to ask that we schedule that for next week, simply because we want to make sure that we are fully informed on everything, so that when we bring that back to you, then it'll be something that'll be absolutely correct. And Dr. Duncan will be here next week to talk about those.
Okay.
Apparently that's been a long, drawn-out process, several years in the making, and they've been working with Cook's Children, and so there's a lot more to it than just the headlines.
And it predated Dr. Duncan's
Yes, it did.
life,
Yes, it did. So,
apparently.
and just one final thing on the agenda. We're going to take things today, we're going to be taking things in order in the agenda to try to.
Why don't we want to do that?
Oh,
I'll see if I can mess that up at least somewhere
that's
along the way.
different.
You know, there was a great debate to even mention it to you, Judge. I was going to tell the other four before that. And then finally, also just a reminder that while we will be having court on the 16th, on the 23rd of this month, we will not be having court, but we will be having court on August 30th. Okay, thank you.
I'm just trying to figure out what I'm going to take out of order here. We could take the Commissioner's Court announcements, but we'll go ahead and do those now. Does anybody, you have an announcement?
You know I do.
Well, you know, there's,
I think Commissioner Brooks does as well, so
I do.
please go for it, sir.
On this coming Saturday, August 13th, from 9 a.m. to 2 p.m., Precinct 1 Healthy Lives Matter will be sponsoring its 7th annual Alzheimer's Educational Seminar. This event will be held at Tarrant County Trinity River Campus the one on this side. The mission of this initiative is to provide accessibility to education, which will lead to improved care and services to individuals confronting dementia, their caregivers and families, in an ongoing effort to improve the quality of their lives. Alzheimer's is a very devastating disease, and the people who care for people going through that Alzheimer's journey have to know where the resources are in the community to give them, to extend their ability to care for their loved ones and to extend their ability to care for themselves in the process of caring for their loved ones. So come on out on Saturday. If you've got someone going through that journey, we can help.
Thank you, sir.
I have two quick announcements. One is tomorrow, Wednesday, August 10th at 6 p.m. via Zoom and Facebook Live. We, Commissioner Brooks and I, along with Representative Chris Turner, Vinny, and Kelly Tillman, the Chief Clinical Officer with the Health Center, we will be hosting a monkeypox town hall. So please tune in, get some valuable information. Unfortunately, some people have been lazy in thought in making assumptions as to who is affected by monkeypox, and we could all be affected by monkeypox, even though there are some folks in our community right now that are disproportionately impacted. So, great opportunity to educate yourself on monkeypox. Again, that's tomorrow, Wednesday, August 10th, from 6 to 7 p.m. via Zoom and Facebook Live, and you can go to my Facebook at COMM Devin Allen. Second announcement is please save the date for Wednesday, August 31st at 11 a.m. We will be hosting our next quarterly Precinct 2 JPS bond update to the community. That will be virtual as well, and please stay tuned. We'll be putting out information on how you can RSVP for that. That's all I have.
Commissioner Fickus, you have anything?
We have our bi-monthly coffee with the commissioner this Friday at our office there on Grapevine Highway in Hearst. And so we look forward to that, and hopefully we have some people come by. So we'll be doing that.
Thank you. Commissioner Johnson, do you have anything at this time?
No, sir, thank you.
One thing, I've had a couple of offices call in and indicate that there's some confusion with regards to people who can just come into the offices and video and where the limits of that might be. So I would like to ask that the DA, GK, that we schedule a briefing item, maybe not on this next Tuesday's agenda, but if it, depending on how it suits, either this next Tuesday or the 30th, whichever one would be best, and just some parameters on, where there is free access and then where that stops and becomes somebody's private office.
Absolutely, absolutely.
Okay, with that, you have before you the minutes of our special call meeting of July the 26th and our regular meeting of August the 2nd.
Move approval of both.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion pass unanimously. Resolutions, Commissioner Allen.
Yes. Thank you, Judge. Well, today I am honored to recognize the Help Center for LGBT Health and Wellness. And while Pride Month was in June, I thought it'd be fitting to still recognize this organization for all of the great work that they are doing in the community. And whereas lesbian, gay, bisexual, and transgender LGBT Pride Month is traditionally celebrated each year in the month of June in recognition of the 1969 Stonewall riots in Manhattan, the tipping point for the gay rights movement in the United States. And whereas Pride Month is a celebration of the LGBT social movement, advocacy, achievements, and a commemoration to the lives lost to HIV/AIDS and hate crimes. And whereas, founded in 1994, HELP, one of the largest organizations in Tarrant County serving the LGBT community, addresses a critical need to connect health education and prevention services to marginalized populations. And whereas HELP currently serves more than 4,000 individuals each year, and in 2021, they distributed more than $31 million in free life-saving medications to patients and are the only clinics in the nation providing access to PrEP medications free of charge. And whereas now the Help Center for LGBT Health and Wellness is expanding, broadening, and magnifying its efforts to enhance the lives and well-being of the LGBT community by making vitally needed care available to at-risk adolescents and adults, HIV-positive individuals, ethnic and sexual minorities, and the LGBT community as a whole. Now therefore be it resolved that we, the Commissioners Court of Tarrant County, do hereby commend Help Center for LGBT Health and Wellness for their advocacy and for organizing the City of Arlington's first ever Pride Month event. Further, we join our friends at Help Center for LGBT Health and Wellness and our fellow LGBT citizens in celebrating and honoring the history of the LGBT rights movement and in supporting the rights of all citizens to experience equality and freedom from discrimination. In witness whereof, we have hereunto set our hands in cause of City of Tarrant County to be affixed this 9th day of August 2022. And with that, I move for adoption of this resolution and will ask DJ Johannesson to join me down at the podium.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Before DJ begins,
Uh-oh.
I want to welcome my dear friend to Commissioner's Court this morning. I have been a partner of the Help Center since its inception and have watched it grow over the years into a major player in the delivery of health care to targeted populations in Tarrant County. I am grateful for your leadership and for the consistency of your vision and service to our community. So welcome. Go for it, Deej.
Thank you so much, Commissioner. And I want to thank Commissioner Allen and Commissioner Brooks for your support of our organization and the community. I have had the opportunity to be the Director of Help for the past 24 years. I've known GK from 100 years ago. I walked in, what's going on?
We both had hair back then.
We did, and mine had some color to it, you know. But our organization has grown. When I took over as the director in 1998, we had 4 staff and a budget of about $125,000. And this year we have 26 staff and a budget of about $35 million. We have 2 clinics here in Tarrant County, one in Fort Worth on 8th Avenue, the other one in Arlington on South Street, right next to the county courthouse. The services we provide, we had mainly worked on HIV prevention. And there's a thing called PrEP. We started a PrEP clinic in 2017. For those of you who don't know, PrEP is pre-exposure prophylaxis. It's a pill you can take every day. And if you take your pill every day, it is 99.99% effective in preventing HIV. So if you take it, you don't get it. We are the only clinic in the nation that provides that free of charge. Whether you have insurance or don't have insurance, whether you make $200,000 a year or whether you don't make a penny. We currently have almost 5,000 patients, so we've grown there, and distributed a little over $30 million a year in medication. And by doing, according to the CDC, having 5,000 patients on PrEP, what we are doing is we are avoiding more than 200 new HIV infections every single year. And so it's not only quality of life, but it's preventing future costs. As we've grown from just prevention to more clinical stuff, more recently, I've had the opportunity to work with our public health department and Vinny on monkeypox. And it's really hitting the community, and I started a couple weeks ago calling Vinny, saying, what are we gonna do? What are we gonna do? And I have to commend your team here at the Tarrant County Public Health Department, because initially the state of Texas received 726 doses of vaccine for the entire state. Indiana got 2,500. So we don't ever lobby, but we advocate. So we managed to advocate with Commissioner Brooks, with Devin Allen, with our state representatives, and with our congressional people. And said, Texas needs its fair due. And so we've had an increase. We got 20,000 doses. Now we're supposed to get another 50,000 doses. And we've been working very closely with the Public Health Department on making sure they are partnering with local organizations so that we can get it out in the community to those most at risk. And last Thursday, we received our allocation of 250 doses from the Tarrant County Public Health Department. On Saturday, we administered all 250 doses in one super clinic. Right now, I have over 800 people on my waiting list. These are just our patients. If we open it up to the community, we're talking thousands. So anything you can do to assist Tarrant County Public Health Department in getting more vaccines allocated to Tarrant County, we will partner with you in distributing, because we all need to play to our strengths. You all are able to work with the CDC and the state in getting allocations. Our strength is getting those doses to those most at need. And everybody playing to their strengths is what makes us a good community. And we have the opportunity to set the standard in Tarrant County so that all the other counties say, well, how'd they do that in Tarrant County? How'd they get it one day and get it distributed and in arms 2 days later? It's because of the strength of the relationships, and we want to continue that. I thank you for this proclamation. I look forward to working with you all in the future and addressing all the public health needs that we have here in Tarrant County, and I appreciate your support. Thank you.
Thank you, DJ.
Thank you very much. Court members, you have before you the consent agenda with the changes as indicated earlier.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Commissioner Fickus, I need you to.
Yeah. Are we on? That's the whole problem right there.
Motion passes unanimously.
Members of the Court, we can go to the Administrator section. Item number 1, we're requesting that the Commissioners Court receive and file the weekly update as relates to the COVID-19 recovery report.
Move to receive and file.
Second.
We have a motion and a second. Any discussion?
I do have a few questions on the small business assistance grant. Do I ask those now, or you want me to do that under another item?
I tell you what, give us, there you go. How about shoot us in the back?
Yes, ma'am.
Hi, how are you?
I'm good.
Good. Okay, so a couple questions. I know that we will start to approve the applications by court action today. But so for right now, based off of the report, we have 526 eligible reviews, final reviews complete, and they were deemed eligible. What does that correlate to from a spend perspective?
So I'll say it this way. So today, we're approving 152 applications
Okay,
for $2,064,000.
264. Okay,
When you look at that number on the sheet where it says our total applications received is that 3,068 number, that is the unscrubbed number. That's just the total amount that we've received. The number of initial reviews are the initial reviews that have been completed through IEM. So that's only just that very first phase that they've gone through. The eligible, this 583, would be out of that 1,655. IEM has deemed them eligible to move on to the next round, which would be county review.
okay,
So that does not necessarily mean we have received all of those files for our review yet.
okay.
They're coming in batches from IEM for our auditor's office to turn around and review. So obviously this 152 doesn't sound like many applications, but they took their time with this first batch to make sure that the process was established and that we can move forward with the next applicants hopefully a little bit quicker. So,
Okay, very good. So then, I was happy to see some of the cities that previously had zeros, now I've got
Yes.
some ones and even some even larger numbers, so that's good. But so as we're approaching this August 31st deadline, have you all already had a discussion about, depending on what our spend is, if we should extend that deadline, or are we able to do that?
We have internally discussed that. I know that will be a court's decision,
Sure.
obviously, but we have discussed that. We are, obviously, if we were to approve all 3,068 applicants, we would have expended the 25 million by now. So we can review that as it gets a little bit closer.
Okay.
I will tell you that I know we had talked a little bit last week about a push through radio, making sure we were getting the word out to everyone.
Yeah.
We did work with Belmont. We are going to begin a push on the week of the 15th.
Okay.
So that'll cover 30-minute, 15-minute spans for paid media outreach related to small business. And that will be in English, Spanish, and Vietnamese.
Great.
We do have a paid spot with DVR.
Good.
And so when those interviews do come up, we'll be reaching out to y'all's offices to see who's available for interviews.
Okay, that's great. No more questions?
Anything else?
No,
Thank you.
That's it.
Any other discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Members of the court, we can go to item number 2. We're requesting 2 actions, really. One is the approval of any changes to the FRF funds budget, and the second one is a list of those items that will appear on our agenda today for approval. As it relates to any changes on the budget, there are no actions requested on this, and on the second one, on item B, there's an attachment to your court communication listing the 5 areas or the 5 programs we're going to be seeking approval on today. So we're asking that you receive and file this document.
Move to receive and file.
Second?
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So members of the court, we can go to item number 5. This is one of those items that are funded by FRF funds. We're requesting that the Commissioners Court approve a subrecipient agreement with the Tarrant Area Food Bank for the capacity building program, which is part of the FRF funds program.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So members of the court, on item number 6, this again is one of those that are funded by FRF funds. We're requesting that the Commissioners Court approve the First Amendment to an agreement with Alliance for Children for the Child Advocacy Services Program, which is funded through FRF. What this does, this adds an additional $230,000 to the original agreement that the court has previously approved.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Your Honor.
Thank you. Ms.
Move
Clay?
to receive and file personnel agenda.
Second?
We have a motion and a second to receive and file the personnel agenda. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Good morning, and thank you.
Good morning.
So we have a few more items for the court this morning. Item 2, we're asking the court to approve an extension of project employment. This is in the county clerk's office. Ms. Nicholson is requesting an extension of employment for one of her project employees through August of 2023. This employee is assigned to their document imaging project. There is no fiscal impact to the general fund. This particular employee we've inquired about with the county clerk's office and have been assured that this employee has been encouraged to apply for full-time employment. He's done that. It appeared to us that most of his applications have been outside of the county clerk's office, but he's doing well where he is. He's being encouraged to apply for full-time employment. And so again, the request from Ms. Nicholson is that his employment be extended through August of next year,
August of
of
next.
2023.
Continue to encourage him, please. I move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. Our next item, we're asking for an out-of-class pay extension for juvenile services. Mr. Medlin has a probation officer who's assumed a higher level responsibility since May of this year. As the court is aware, after an employee has assumed responsibilities for 90 days, the policy requires an extension by the court. So therefore, we're requesting an extension through November of this year. We are looking at a cost of approximately $1,064 and some change. However, this cost will be offset by salary savings.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
So for our fourth item, I'm going to ask Ms. Duckworth to come to the podium and discuss this item with you. While she comes, though, I do want to remind employees that we currently are offering biometric and PSA screenings at multiple county locations. There was an email that was sent out this past Friday, August 5th, from Henry Tolstad, the county's wellness coordinator, that explained the ongoing screenings. Again, there are multiple locations. I want to remind employees that you can earn 100 wellness points for the biometric screening. There is no fasting required for either screening, the biometric or the PSA. You must register for the biometric screening. Walk-ins are allowed for PSA screenings. Last opportunity to redeem, the word that I'm going to use, your wellness points, is October the 31st. If you do plan to schedule a screening or show up for a screening, employees must bring their Tarrant County ID card as well as their insurance card. So again, check your email dated August 5th for more details. Thank you.
Again, I want to thank HR for adding PSA screening to the inventory of screening, health screenings that we do countywide.
Good morning.
Good morning.
How are you?
Good, how are you doing?
Good.
Good. So today we are seeking your approval of the 2023 plan choices, service providers, and the contribution rates for the 2023 healthcare benefits for both Tarrant County active employees and retirees. The information that is presented has been recommended by the PVC Board of Governance and the Tarrant County Benefits Committee. And I'd like to go through each exhibit and request court action independently on each exhibit. So we'll start with Exhibit A. Exhibit A outlines the annual contribution limits for the health savings account and the flexible spending account, and one enhancement on the HDP and PPO medical plan. So first, the IRS has increased the allowable annual health savings account contributions in 2023, which includes both employee and employer contributions. And those enrolled in the high deductible medical plan as employee-only coverage can contribute up to $38.50 in their health savings account. That is a $200 increase from this year. And that does include both the employee and employer contributions. For those enrolled in employee plus spouse, plus children, or plus family, they can contribute $7,750 next year. That's an increase of $450. Again, that includes any employer contributions such as the $750 employer seed money. If you are age 55 or better, you can continue to contribute that $1,000 as a catch-up to your health savings account in 2023. Next, we'll talk about the flexible spending account maximum contributions. Those increased by $100, so it's going to be $28.50 for 2023, and that amount does not include the employer contributions. It does apply to both the limited and general purpose flexible spending accounts. You may recall that the IRS allowed 100% carryover of unused flexible spending account funds into this year, plan year 2022. That is not an option for 2023. The carryover limit of unused FSA funds to 2023 is capped at $570. So anything over the $570 would be forfeited back to the county, so plan accordingly. And then next is one enhancement on the United Healthcare PPO and HDP medical plans. It is called virtual primary care. This feature allows you to connect remotely with a virtual primary care physician for preventive care, follow-up visits, and checkups for ongoing conditions like asthma, diabetes, and more. You can connect with a virtual PCP through the website myuhc.com or through the UHC mobile app. There are no further plan changes to either the HDP, PPO, or the retiree medical plans, and no provider changes for 2023. Any questions on Exhibit A?
Do you have a question on the carryover? So I understand that that was based off of the IRS rules, but what, did they just totally change the carryover amount, or was there like an exception because of COVID?
There was an exception because of COVID.
Gotcha. Okay, that's all I had on this part.
Okay.
So you want a motion on this one?
I would.
Move approval of plan changes.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
While Commissioner Fickus just posted he's absent right now. Motion passes 4 with 1 abstention.
Okay, Exhibit B is our 2023 service providers.
Maybe it's not an abstention. Is it just, it's just 4?
It's just 4-0.
It's a
4-0.
non-vote.
Of course, right now, it is now 5-0. Do you support that?
Yes.
So it's unanimous. Go back and change all your little records.
Okay,
I
Exhibit
figured I could delay that long enough.
Exhibit B is our 2023 service providers, premiums, and admin fees. We have minimal changes on Exhibit B for 2023. I'll go over those changes, which are highlighted in yellow. So if you'll jump down to item number 4, the UHC admin fees for the HDP and PPO medical plans. We had a rate hold for 3 years with escalators in place for years 4 and 5, and this is year 4. So there is an increase of 3% for the base admin fee, which is $35.29 per employee per month. On number 5, the EAP admin fee is not increasing, but the wellness program admin fee on number 6 is also increasing by 3%. It will be $2.84 next year. And then on page 4, number 8, our reinsurance or stop loss with United Healthcare is unknown at this time. We should receive rate information in October. And then on number 9, we have pharmacy service admin fees with CVS Caremark. That admin fee has actually decreased 10 cents to 25 cents per employee per month. And there are no other changes to report on Exhibit B. Are there any questions?
Can I have a motion?
So moved.
Second.
We have a motion and a second. Any discussion?
Yeah, I do have a question. This is just generally, so since the overturn of Roe v. Wade and following the news and tracking other issues that have come up as a result of that, this may be triggering for some, so I apologize, but for dependents covered under this plan, will they have any issues accessing care related to miscarriage or ectopic pregnancy or anything like that? And I know you may not have that answer right off the top of your head, but I would like to know, because I know that there's an issue. I think it's still, there's still a federal law on insurance, and there may be issues with providers and with pharmacists, but we're talking about life-saving procedures for women, as well as managing costs as well for us as providing insurance.
We've not had, in the course of our discussions, Gallagher nor VBC has brought up any issues regarding that. We have not in any way, shape, or form changed our benefits, so if anything happened, it would have to be as a result of state law, and we've not seen any interpretation on that.
Okay.
But we've not been asked to change any of our plan, benefits or provisions as a result of the change. But we'll check it.
Yes.
If we could.
Sure.
And I'm fine with supporting it now, but if there is some change and it requires us to have some further discussion, then I may change my mind.
Okay,
Okay, thank you.
sure.
No further discussion, please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Okay, on Exhibit C1, we'll discuss the 2023 active employee monthly contribution rates. At the top of the page are the current 2022 medical rates with the census on the left side of the exhibit. And you'll see both the high deductible and PPO medical plans. And then the bottom portion of the table shows the proposed 2023 active monthly medical rates. The HDP plan reflects a $7 per month decrease for all 4 tiers. So employee only, employee plus spouse, children, and family. And the continuation of the $750 employer seed money into the health savings accounts. We are recommending no rate change on the PPO medical plan. And you can see the monthly rate changes reflected on the left-hand side in yellow on that table of Exhibit C1. If an employee were to move from the PPO plan in 2022 to the high deductible plan in 2023, there is a triple-digit savings at the Tier 2, 3, and 4, and an $83 savings per month for the employee-only coverage level. Any questions on Exhibit C1?
So you move from PPO to HDP. So for an employee only, it's a decrease of $90.
$83.
It's
Oh,
an-
excuse me,
it's an
$90. You're
increase
right,
of-
you're right. My apologies.
I'll move
And
for
then
approval.
$200 for family, the family level. Thank you, DK.
Second.
I have a motion and a second, discussion. Again, I just would say, I know that the deductible is higher, but with the $750 that the county is putting into that, that almost pays for half of the deductible day one. And that money accumulates, and you can, when you leave, when you retire, that money goes with you. It's not in any way, shape, or form kept by the county, and it's a great way to be able to build up a kind of a little nest egg, tax-free in the future when you do that. So if you've got some questions, I would strongly suggest sitting down with HR and answering any questions. You may still decide not to go into it, but be sure your questions are answered, because I feel like that's an excellent way to go. No other questions or discussion, please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Okay, on Exhibit C2, this is the 2023 pre-65 retiree contribution rates. So this is the non-Medicare retirees. This is the group where the county subsidy is tied to Tarrant County years of service. This group is on the same HDP and PPO medical plans as active employees. And on the far left-hand side of the page are the years of service groupings, followed by the census in the second column. And of the 354 retirees enrolled, we have 13 that are enrolled in the high deductible plan, and 341 are enrolled in the PPO medical plan. And to the right of the yellow column are the 2023 premiums. The yellow column will reflect the monthly changes, and we are recommending no rate action for this group. The only difference, again, shown in yellow, would be if a retiree moved between the two medical plans. Any questions?
Move approval.
Second.
We have a motion and a second, discussion. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Exhibit C3 is our 2023 Medicare eligible retiree contribution rates. This is a little bit different exhibit than years past because there are additional rates. Exhibit C3 shows the fully insured Medicare plan rates are not changing for plan year 2023. That is the Medicare Advantage PPO and the Medicare Advantage HMO plans. So no rate change for those. And again, those are the fully insured plans. After much discussion with our internal benefits group, we are recommending that the years of service groupings be applied to the group of retirees that are enrolled in Medicare, but still cover a non-Medicare spouse or child. If you recall, in order for a retiree to receive a county subsidy, they must have at least 10 years of Tarrant County service. Otherwise, they pay 100% of the cost. For those Medicare-eligible retirees covering a non-Medicare spouse or child, the additional rates are applying the same subsidy for years of service percentage that we apply to the pre-65 or early retirees. So applying this same subsidy percentage based on years of service has generated a decrease in retiree rates to all tiers and all plans for this group, with the exception of the 10 to 14 years of service group. And currently, we have 0 census in the 10 to 14 years of service group. The census is displayed in the first column. We have, of course, the highest census in the 25-plus years of service category, which is at the bottom of Exhibit C3 on pages 8 and 9. And this group will receive the highest county subsidy. You can see the monthly savings to the retiree in the yellow column. And then on page 10 of Exhibit C3, we're showing the senior supplement plan without prescription drug coverage. That's a grandfathered plan that only 2 retirees remain enrolled in, and there's no rate action on the senior supplement, but we do have a rate action for that one that does cover a non-Medicare spouse, and they happen to fall in the 15 to 19 years of service category. Any questions on Exhibit C3?
Will you say that last part again?
The senior supplement group on page 10, that is a grandfathered plan that when we made the choice to go to the Medicare Advantage PPO plan, we had a handful of retirees that were enrolled in this plan without prescription drug coverage. United Healthcare allowed those folks to stay on because it is problematic and you cannot have more than one prescription Part D drug coverage plan as a retiree.
Okay,
So we just have 2 remaining there.
gotcha. Okay, thank you.
You're welcome.
Move approval.
Second. We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Thank you for, you got one more? I'm not going to let you have one more.
Be nice.
So close.
So close.
Exhibit D is the dental and vision plans. So we are recommending a rate increase on the PBC PPO dental plan. You can see in the yellow column, the increase is $3 per month for employee-only coverage, $5 per month for spousal coverage, $7 for children, and $10 for family coverage for 2023. And the dental and vision plans, the dental DHMO dental plan, and the vision plans are fully funded by the employee premiums, so no subsidy by the county. And then the Delta Dental HMO and the VSP vision plans are fully insured, and those premiums are not changing in 2023. Any questions on Exhibit D?
Move approval.
Second?
A motion and a second. Tried to shut you off before you increased that dental rate. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank
I really want to thank Amber and the members of the Benefit Committee. We worked for about a year. We didn't have quite 42 meetings, but close. And it was specifically on the retirees with Medicare or non-Medicare spouse. And I feel like we've reached a very good place in that deal that truly recognizes what Tarrant County's feelings are toward their retirees and the folks that have gone into that. So appreciate your hard work.
I appreciate all of y'all's hard work, because that's a category that increasingly interests me.
4 months and 22 days.
2 years, 4 months, and 22 days.
Juvenile Services, come on down.
Good morning.
Good morning, Judge, Commissioners.
Morning.
I have 3 items for consideration on the agenda today. These are 3 contract renewals. The first one, number 1, is we're requesting approval of fiscal year 2023 contract renewal between Tarrant County and MHMR for the provision of drug and alcohol services and assessments for youth under the care of the Juvenile Probation Department. This is renewal of that contract. It has been reviewed by the District Attorney's Office and approved by the Juvenile Board in the July board meeting.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Item number 2, we are requesting the fiscal year 2023 contract renewal with MHMR to provide residential substance abuse treatment at the campus for youth and their families in need of services. That contract provides 16 beds for youth that require inpatient treatment. We've had that contract for a number of years. The District Attorney's Office has reviewed and approved the contract, and the Juvenile Board approved it on July board meeting.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Third and final contract for consideration is we're requesting the Commissioners Court received and filed a contract renewal with MHMR for mental health assessments at the Lynn W. Ross Juvenile Detention Center. This contract provides mental health assessment, treatment services for trauma, individual counseling, crisis intervention, consultation, and case management services for youth in our care in our detention center. It's been approved and reviewed by the Criminal District Attorney's Office and approved by the Juvenile Board in our July board meeting.
Move for approval.
Second with a question. Why is this third one a receive and file and the other 2 were approvals?
I can answer that.
Go for it.
So, when you look at funding for the juvenile services, some of it is state funded through grants and appropriations, and some is funded by general revenue funding by the Commissioners Court. Whenever we have grants that are funded through the state, there's a requirement that the board the juvenile board approve those contracts, and we don't have any activity on that. Whenever it comes, but what we do receive and file those simply because it creates a place to put public documents. So that's why we have this.
So this one is fully funded by the state.
Except for the fact that there are some monies that are FRF funds that you only previously approved. And I will say one more thing, is that normally you would see this on consent, all 3 of these, but because the court has a policy that whenever we do an expenditure of FRF funds, that you requested that it not be on consent, but an action item of the court.
Thank you, Mr. Maney.
Thank you, Judge, Commissioners.
Don't go off yet. I haven't voted.
Oh, I'm sorry, sir.
Vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Madam Judge.
Purchasing. Now, if someone was of a mind, we might take a motion to pass all 7 of these at one fell swoop.
Oh, I'm of a mind. Move approval of the purchasing agenda, items 1 through 7.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Melissa.
Thank you.
Great to see you, Melissa.
GK asked, what did I do?
How does that work?
Just, if we had only thought about this when Jack was around.
GK's just hating.
Thank you very much.
Take care.
Now I gotta catch up with it. I think we are now at commissioners and judge. So Commissioner Brooks, I believe you actually have an agenda item for us
I
today.
do, and the Roman numeral on that would be what?
10K1 A and B.
I move approval of what he said, 10K,
Second.
1A and B, an interlocal agreement with the city of Crowley.
Second?
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank y'all.
Are there any appointments today? There being none, then you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second?
We have a motion second to approve the claims, including the addendum. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Briefing items, Mr. Manius.
Thank you, Your Honor. On item number 1, we have provided a slide presentation for you, a PowerPoint presentation in your red folders. So we will not be making a presentation on that this morning. If we could move into item B. This is the Tarrant County COVID-19 after action report. Mr. McCurdy is here to introduce the presenter.
Morning, everybody.
Good morning.
Morning.
Yes, it is still morning.
It better be when we end.
I hope so. We've asked to do a look back at how we did with COVID. I've been around for a while, and that's probably one of the more bizarre, 2 or 3 years we've lived through. So we went and asked permission to go back and see how we started, how we got into the groove, so to speak. And so what we did is we contracted with IEM, trusted partner in a lot of things here in the county, and asked them to go back and look how we started up to about the middle part, which was late last year. And we have brought today the draft copy of this. We're not finished with it yet. We still have some things left to do. But I'll ask Katie McCoy if she would come up from IEM to go through this with you. And obviously, if you have any questions, we'll certainly do that.
And David, you did provide them with a copy of the draft report.
Yes, you have a copy there, and like I say, it's in draft form, and we have some work left, but we'll continue.
Good morning, Commissioners and Judge.
Good morning.
morning.
How are you?
Can you hear me okay?
Yes.
Okay. Thank you for having me back. It's good to see you all again. I'm not talking about ARPA.
Good to see you as well.
Thank you, sir. While we're not talking about ARPA today, I did just want to say I'm excited to see that my colleagues over in our grant management projects, they're working closely with your staff here to make sure that those applications are approved and moving forward after all the work that we did at this time last year. But I am talking today about the COVID-19 after action report for Tarrant County. We'll talk a little bit about the purpose, how we found what we found. We'll talk about the areas of focus that we divided those findings into, and then the strengths and areas of improvement, and then the way forward, just some recommendations that we're making to address some of the findings that we identified through this process. So our purpose was really to do a preliminary look of how Tarrant County did during the response, primarily looking at March 2020 through September 2021 to that first 18 months, which is a pretty good chunk of time, and then identifying and documenting strengths, areas of improvement, and then recommendations for how to address those. Our methodology, we did a 3-part series. So we did data collection. The county was kind enough to provide us some documentation that you already had in the form of executive orders and incident action plans. We also did surveys. So we did partner as part of the ARPA public survey that we did. We included some questions about testing and vaccination to get the public's feedback on how those sites worked and if they utilized them or not. We also did a survey for county employees, as well as some of the local stakeholders who were instrumental in the testing and vaccination sites. We also did interviews. So we We did one-on-one interviews with a number of individuals who were at the local and the county level, as well as some of our hospital partners and our BOADs. We also did some group conversations as well. So we did a couple of interviews for the local jurisdiction and the public health individual who ran testing sites and vaccination sites and how that collaboration worked. As part of that, we looked through the responses that we got and analyzed the feedback that was given to us through the surveys, through conversations, and through the roundtables that we did, and then broke those out into strengths and areas of improvement and developed an improvement plan. That implementation and improvement plan, we're still working through with the county administration's office, so identifying who's going to be responsible for the action items that we're recommending, if it's something that we actually want to pursue, and then what the time frame could be for those items. So like I said, we did some incident documentation, interviews and roundtables, and then we had about 41 survey responses from the county participants as well as the local participants, which it wasn't quite as high as we had liked, but that's okay. We still had a lot of really good in-person or virtual conversations that gave us the information that we needed. So the surveys, we had a little over 4,500 responses for that, the public survey that we did with the ARPA project that gave us some information about testing and vaccination sites. We did do roundtables for, we looked at some of the concurrent emergencies that we had here in Tarrant County, specifically the winter weather in February of 2021, the sheltering operation for Hurricane Laura in the fall of 2020, and then the response and how COVID impacted the response to the protest marches in June of 2020 as well. You'll see the list of interviews that we did on the right-hand side of the screen. We were able to talk with a number of our hospital partners, of our local stakeholders, and then within Tarrant County, everyone from a person who staffed the entrance to a testing facility to department heads as well. So we had a really good range of feedback for those interviews. So we broke the information that we received into focus areas. There are 11 focus areas. We focused primarily on policy and executive leadership. So that's the court as well as GK's office. We looked at multi-agency coordination. So that's how did the county interact with the local jurisdictions. The internal coordination, so that's intra and interdepartmental coordination for Tarrant County. Critical county functions, so how did you maintain those critical county functions through COVID when people weren't coming in or there was limited capacity for that? We also looked at public information and warnings, so the crisis communications that were sent out. Procurement, resource request, and cost recovery, so how did we maintain our supplies throughout for critical PPE and making sure that we could recoup cost with FEMA if that was available. We also looked at testing sites as well as public health laboratory capacity. We looked at non-pharmaceutical interventions, so protective measures that were implemented either through executive orders and mandates or recommendations later on in the pandemic. We looked at vaccinations, so how did we do as far as pushing vaccines out to the public, as well as the health and medical systems and that collaboration there. And then last but not least, technology. So how did our technology aid or inhibit us through this process? That report that you have in front of you has a very detailed list of things inside of it. I'm going to talk high level about strengths and areas of improvement, but I would highly recommend if you have a few minutes, skim through it and look and see all the great work that your teams did here at Tarrant County, and then some of the things that we could probably do a little bit better moving forward. So our key strengths were really the communication and coordination with local jurisdictions, community-based organizations, nonprofit and volunteer organizations. This is something that we heard repeatedly through this after-action report process. Tarrant County is well known for being collaborative and finding unique dynamic solutions for problems that you face. So this should not be a surprise for anyone, I don't think. The frequent and proactive messaging to the public on constantly evolving guidance, direction, and executive orders. So really being forthcoming to the public from the court and from your public information office so that residents were up to date as far as what the current guidance was. The expedited development of multiple public health dashboards for testing, vaccination, and the number of confirmed COVID-19 cases. We know that this was a very labor-intensive, personnel-intensive, time-intensive process to get those numbers correct and accurate to be posted. So we do want to highlight the good work that the people in public health informatics and I think their EPI department was involved in that as well. So they did a really great job as far as that, and then developing brand new dashboards in the middle of everything else that was going on. And then last, ability to dynamically shift the county's strategic approach based on the evolution of the pandemic through policy guidance and operational adjustments. So right-sizing the response, I think you guys started out doing daily calls or twice-a-day calls, and then stepping those down as we saw the need to, and not just keeping people, meeting hostage just because we want to have a meeting. So really great job, right-sizing that and then giving that strategic direction for the county. Any questions on strengths? Okay. The primary areas of improvement, this is something that came up pretty consistently, so that's incorporating a formalized incident command structure into the response. There are plans that the county has, like the Emergency Operations Plan and the Strategic National Stockpile Plan, that have outlined incident command structures. From what we heard through those interview processes is that wasn't necessarily implemented at an operational level at the beginning of the pandemic, and then it created some task saturation for employees or for staff as they moved through and their span of control got bigger and bigger and bigger, and nothing was pulled off their plate and reallocated to somebody else. So just, that's an easy fix, but something that needs to be addressed. Clarifying expectations regarding the daily confirmed COVID-19 counts, number of tests and vaccines, and updates to the corresponding dashboards. I mentioned that this was a very labor, personnel, and time-intensive process. So letting the smart people who work on those items set the pace for that and know what's realistic and what may need a little bit more time. And maybe it may not be daily, but it may be close to just knowing that that's a constant evolution of data that they're having to dig through that's going to be a little bit tricky. Consolidating appointment registration platforms with the county's electronic health record. I know that there are already some things in the works for this, so looking at how to modernize the EHR for public health, but there was some confusion from what we heard for testing and vaccination sites for, I registered for an appointment, but now I have to fill out duplicative information once I get here. If those systems can talk to each other, great. That would just make everybody's life a little bit easier, I think. And then the next one is standardizing the county's telework policy and subsequent technology needs. We did hear that there was an IT rollout starting in January where there was a move from desktops to laptops. Some departments had implemented, some hadn't. So, best laid plans, but just getting those resources out to the employees who are going to need that. Any questions on areas of improvement?
So I know you had to narrow which areas of improvement that you highlighted for the purpose of this summary presentation. But I was disappointed to see that the area for improvement that made it into the draft book, the equitable access to information, to me that's huge. And it's an issue that we still struggle with. And I'm hoping, GK, once we get the final version, that we'll have a thoughtful conversation about what if these areas for improvement need to turn into policies so that once we're not here, we've all lived through COVID together and know what we tried and what didn't work and also what did work. But for future courts, and they'll have to make their own decisions, but no one's gonna pull up this book. They're just gonna go with what is clear to see that we did in the past and how we learn from our mistakes, so.
That's a great point. Thank you
Yeah.
for that, Tina.
So GK, I definitely want for us to talk more about this.
We've already noted it.
Thank you.
So our recommended next steps, these are some items that are, some are short-term, some are long-term, as far as how to address those key strengths and areas of improvement that we identified. The first one is that continuity of operations plan review and planning process. So that's really giving the county a foundation for how to operate if this ever happens again. When you send, the majority of your workforce home, how do we keep people working, productive, but still give them the ability to protect themselves and stay safe? We also recommended providing training and exercise opportunities to address the gaps that are identified within the AAR that's specific to the incident command structure. There's also some items in there regarding testing and vaccination sites setup and operations. So there are some pieces for that for testing and exercise opportunities as well. And then incorporating that incident command structure for future incidents, as well as investing in public health informatics to continue the efforts made during COVID-19. As you can see, emerging infectious diseases, they don't necessarily go away. They just evolve and become something different. So now that we've set a standard for the public to know that we're going to continuously update a dashboard, making sure that that can actually be carried forward and done for future emerging infectious diseases. And that is all I had. Do you have any questions for me, any comments?
So if this is the draft report, when should we expect the final?
So we're still working with the county administration's office to finalize some items, and we've received a couple more inputs as far as things that we need to include in here. But once, I'll work with David to get a finalized date for that as well.
Thank you.
Of course.
Thank you.
Thank you.
Thank you very much for your report.
Thank you all so much.
Members of the court, we do not have anything on item number C. This is a standing item on the budget-related issues. I think we talked about that yesterday a little bit. You'll see this on every one of our agendas until we pass the budget and set the tax rates. But I believe that we're reviewing some of the issues that we addressed yesterday, and hopefully we'll start having those discussions with you next week.
Okay.
Your Honor, that's all that we have at staff level.
Okay, we have a public comment. Mr. Colancasi, please come forward.
Judge Whitley and commissioners, public servants, running out the door. I want to make it, just emphasize once again that the video never lies. One of the things that's happening across the country is a little revolution where the public is recording public officials and law enforcement in the course of their duties. I also wanted to point out this quarterly, and your article you wrote, Judge Whitley, where you quote George Washington, probably the most nonpartisan president we ever had. Partisanship agitates the community with ill-founded jealousies and false alarms, kindles the animosity of one part against another, and foments occasionally riot and insurrection. I'm glad you wrote that article, and I'm glad you quoted George Washington. He set the bar for all of the leadership and executive leadership in our country. Last week, when I gave my public comments, I noticed that the 3 women from Broadway Baptist were ushered out of the room by the sheriff. I finally figured out why he hovered so long waiting to get a chance to visit with them. When I finished my comments, I went out into the hallway and I began to record him speaking to the women in a public space in the course of his duties. And the sheriff himself said, "This is a private conversation, you can't record it." And this goes to the heart of the problem, because the 2 gentlemen in the back of the room, both deputies, are under investigation for bad actions in 2 different settings at 2 different public meetings, one being Tarrant Appraisal District, and the other being across the street at the old courthouse where he unlawfully trespassed somebody for recording in the hallway, actually in the little historic room specifically. I think that this sign that you want to play down partisanship means that soon we're going to hear your personal endorsement of Deborah Peoples as your replacement. But the last thing I need to point out
Don't
with
hold
regard to
your
the
breath.
Sheriff's Department, you can't interrupt me, Judge, in the middle
Sure
of
can
my
when
3
you make a
minutes.
statement like that. Wait and watch.
Okay. It's funny because I was going to point out that the sheriff regularly, as he did in the newspaper, and his staff deflect, distract, diffuse, and then if none of that works, they disrespect. And if you didn't see the third article in the Star Telegram, where the sheriff's staff clearly disrespected the nice women from Broadway Baptist in their genuine concern towards the jail and its conditions, then you don't get what the game is and how it's consistently played in all levels of government.
There being no further action at this time, then we'll recess our open meeting to proceed to close to discuss items exempt under section 551.071, 072, 074, 076, and 087 of the Texas Government Code. I know that's gonna be. Not short conversation.
How do, ladies?
Doing good. How about y'all?
All right.
Thank you.
See, that wasn't painful.
No.
Okay.
You can have a life in you, Judge.
Hmm?
Oh, wait, do we not have,
That wouldn't count anyway.
no, that's true, now that you mention it. The lack of sleep is slowing your brain down right now.
Having returned from our closed session, there being no business to conduct at this time, we stand adjourned. Got all four.